Hello everybody! This video will teach you how to administer the School Function Assessment or SFA. SFA is used to evaluate and measure a student's performance with various functional tasks required for participation academically and socially in an elementary school. It was designed to increase collaboration between disciplines to plan programs and interventions for students with disabilities. The three sections assessed are participation, task supports, and activity performance. The children which can be assessed by this tool can range from kindergarten to 6th grade. Administration scoring could take about 10 minutes to 2 hours. The complete assessment is typically not completed in 1 day. However, it should not take longer than 2 to 3 weeks. Individual scales can be completed in around 5 to 10 minutes. For this assessment, we need the user's manual, and inside is the rating scale guide, which we will see later when we open this book. The record form for each student, and a pencil or a pen, whatever works. Let's see what's inside the user's manual. A manual is a book containing information and instructions on how to do something. That's exactly what's in here. Inside are detailed descriptions of what SFA is and how it can help identify the problem areas that are causing the student troubles. It requires the administrator to evaluate the student in different school settings, including classroom, hallways, stairs, playground, and bathroom. The administrator must observe the student's participation in various school activities, his support needs, and his performance on school functional activities. The administrator and respondents could be those individuals who are familiar with the student's typical performance. This could be teachers, therapists, or classroom aides. If the assessment is being used just to investigate a very specific difficulty the student is experiencing, the rater may choose to complete only the scales related to it. This is the record form of the school function assessment, and up front, you have to supply student information, respondent information, and other information like what languages does he speak and what are his means of communication and transportation. Inside the SFA are parts under detailed descriptions of what you should look out for. First, participation scale examines the level of participation in 6 major school settings. And these settings are the regular classroom, special education classroom, playground or recess, transportation, bathroom or toileting, transitions, mealtime or snack time. Each setting is scored from 1 to 6, with 1 being extremely limited participation and 6 for full participation. The rating for each setting is combined for total participation raw score. Task supports are made up of 4 scales. The first 2 are physical task assistance and physical task adaptations. Each task is scored from 1 to 4, with 1 being extensive assistance or adaptations required, and 4 is requiring no assistance or adaptations. This area is gray because it is optional. Next are cognitive task assistance and cognitive tasks adaptations. A total raw score for each of the components is calculated. Activity performance is based on 21 separate scales. Physical activity performance comprises 12 of the scales, and the other 9 scales are cognitive behavioral performance. Each functional activity is scored 1 to 4, with 1 being no performance and 4 is consistent performance. The score for each scale is combined for a total raw score. In the adaptations checklist, we record the adaptations that the student routinely uses to perform functional activities during the school day. At the back, we record the sums and write them on their respective boxes. This will serve as a summary. But wait! Inside the user's manual is a score guide which contains a transmutation table for the raw score to the criterion score. The score guides are different per area assessed. There's a table for participation, task supports, and activity performance. And you would also find here other information on SFA and more detailed descriptions of each area. Towards the end, there's a sample of a filled record form to serve as a guide. This assessment tool was designed so the test can be administered with only the record form and the rating scale guide. If you noticed, the SFA is detailed and simple. There is no required training to be able to administer the test. So that ends this mini tutorial on how to administer the school function assessment. Thank you for watching and see you in the next video. Bye-bye! Hello everybody! This video will show you how to administer the Biri-Buchtelnica Developmental Test of Visual Motor Integration, or the Biri VMI. The Biri VMI measures the extent to which individuals can integrate their visual and motor abilities. It is commonly used to identify children who are having significant difficulty with visual motor integration and to determine the most appropriate course of action. Additionally, the test can be used as an outcome measure to assess the effectiveness of education and intervention programs. It can be administered by psychologists, learning disability specialists, school counselors, teachers, and other professionals. The full VMI format is designed for ages 3 to adult. It has 24 forms, 3 initial shapes that are imitated and copied directly, making a total of 27 items. The short version, for ages 3 to 7, contains the initial 3 and the first 15 forms for a total of 18 items. The respondent is asked to copy geometric drawings onto a form. The drawings are presented in order of increasing difficulty. Distinct visual perception and motor coordination subtests are included, making it possible to test one skill set to the exclusion of the other. Scoring is completed on the form. There are standard scores, percentiles, age equivalents. The manual has a scoring guide telling the examiner whether the item is done correctly or not. Scoring takes about 10 minutes. There are 2 major reasons why examiners administer this test. For one, it helps build rapport. Almost all children enjoy doing the VMI and become absorbed in it. They like to try the harder ones and do more. This also provides the child an opportunity to become comfortable with the examiner without having to use much verbal language. The other reason is for observation. As the child draws, the therapist can observe the child's attitude, body position, movements, and other important behaviors. A sharp number 2 pencil without an eraser is given to the child. A ballpoint pen would also do. The test booklet is placed face down, squarely, and in front of the child. Now for the actual administration. Usually, if the kid is able to accomplish the tasks on his own, he is given 5 to 10 minutes to do so. This is still with the examiner's guidance and still starting at the age-appropriate page. For example, a 6-year-old who has a functional VMI level, turn to page 4, point to the item and then on the blank space, and say, "Make one like that. Make yours right here." Encourage the child as necessary. Do not, however, trace the form with a finger or a pencil. Do not let the child trace it either. Avoid calling the form by its name or by descriptive term. As many items as necessary, prompt by pointing to an item and say, "Make one like this." When the examiner anticipates a functional VMI level below the actual age of the client, in this case 6, sit beside the client, open the booklet to page 2 and say, "Watch me. I'm going to draw a line here." Point to the vertical line you just drew, similar to the one on page 4, and say, "Make one like that. Make yours right here." If the child does not respond, make repetitive up and down vertical lines over your own first line. Then point to the blank space and say, "Do that. Make yours right here." Remember, imitating drawings is typically easier than direct copying. Repeat this procedure for the horizontal line and circle. If the child succeeds on any one of these 3 imitation tasks, turn to page 4 and have the child to try and copy the images directly. For the whole test, allow only 1 try per item with no erasing. As soon as the child is responding well, say, "Good! Go ahead and do the rest of them. Turn to the next page when you finish this one. Do best on both the easy and the hard ones. Do not skip any. Testing may be ended after 3 consecutive items for which the child earns no points. You may continue as it is often informative to see how a child approaches more difficult items. Also, children often ask to do even more forms. The visual perception booklet is supplemental and should be administered individually only after the VMI. Exactly only 3 minutes are allowed for this test. Do not cover parts of the form to reduce visual distractions. Place one finger on the heavy black outline of box 1 and keep it there until it's time for box 2. Say, "See this line? There is one more line which is just the same down below." Sweep your fingers across the choices and say, "Let's find it." You point to it. If the child responds, make a small mark next to the choice, whether the choice is correct or not. Whether the child responds or not, whether the choice is correct or not, teach the task. Point to box 2 and say, "Point to the other line down below that is just the same as this one." Continue with the same test and teach procedure used for item 1, which is, when the child responds wrongly, point to the 2 small image and say, "It's not this one, is it? This is smaller than the one in the box up above." Point to the correct option and say, "It's this one, isn't it? It's just the same as the one on the box up above." Follow these for item 3 and stop with item 4. Start the timer. Continue to mark correct and incorrect responses. Record any evidence of visual acuity problems such as squinting and head positioning, eye rubbing, or comments, as this will affect the validity of the results and will require another assessment. Conclude the test after 3 minutes. Score the child's first response before you taught him the correct one. 1 point is given for each correct item. A total of 27 points can be earned. The test is concluded after 3 consecutive mistakes or up to the 3-minute time limit. The motor coordination booklet is also supplemental and should be administered individually only after VMI or visual perception tests. Be ready with a timer. Only 5 minutes is allowed for this test. Say, "Watch me draw a clear and dark line from the black dot to the gray dot and try to stay inside the road." Then you draw such a line inside 1A as an example. Point to 1B and say, "Now you do it. Draw a clear and dark line from the black dot to the gray dot. Try to stay inside the road." If the child does not respond, encircle the item number. Trace your line on item 1A. Repeat instructions. If still no response, hold the child's hand and guide it to make the line in 1B. Repeat as needed. Continue with the test teach procedure until starting with item 4. Only say, "Draw a clear dark line from the black dots to the gray dots. Try to stay inside the road." As with the VMI, use a pencil or a ballpoint pen and do not allow erasures. For item 4, start with a timer. Say, "Go ahead, do as many as you can, but do not rush. Draw carefully, draw the forms in order, and do not skip any." If a child completes a form such as item 7 without lifting the pencil, you can say after the child is finished, "Go ahead and lift your pencil to start on new lines," like this. Demonstrate how to draw that form on blank space outside the roads. When the child has completed the first page, turn to the next page and continue by saying, "Some forms on this page have only a few dots and some do not have any dots at all. If a form has a block dot, start there. If it has no dot, start wherever you like. Stay within the rows and make each form look like the small example just above it." Do not stop after the child has made 3 consecutive errors. Continue for exactly 5 minutes unless a child is becoming too tired or is clearly unable to score more points. If you stop before a full 5 minutes is up, record exactly how many minutes and seconds it was when you stopped. Children often want to do some more. If you allow a child to continue beyond the 5-minute time limit for scoring, note the last form done within the 5-minute time limit on the VMI summary chart. An item is scored 1 point if the response meets all 3 of the following criteria. There are pencil marks within all parts of the rows and between all dots. The marks do not have to be complete. No mark clearly goes over the road line, but it is okay to touch or even be on the road line. And space need not show between the line and outside road. 3-dimensional overlaps on forms 24 and 27 must be shown. So that ends this mini tutorial on how to administer the VMI. Thanks for watching. Bye-bye!